Viewers, I hope you are all fine. This ultrasound video shows a case of uterine polyp and two hemorrhagic ovarian cysts. You can see the uterus. This is uterus. This is cervix. A small cervical cyst is also visible. You will see later on when I focus the cervical cyst. Now you can see the uterine polyp. Overgrowth of cells in lining of the uterus, that is endometrium, leads to the formation of uterine polyps, also known as endometrial polyps. Endometrial polyps are benign nodular protrusions of the endometrial surface, and one of the entities included in differential of endometrial is endometrial thickening. Endometrial polyps can either be sessile or pedunculated. They can often be suggested on ultrasound or MRI studies, but may require sonohysterography or direct visualization for confirmation. You can see the cervical cyst. Classically, endometrial hyperplasia affects the entire endometrium and results in widening of the endometrium, while the uterine polyps may affect the distal portion of the uterine cavity, endometrium in the distal portion of the uterine cavity. Uterine polyps are more likely to develop in women who are between 40 and 50 years old than in younger women. Uterine polyps can occur after menopause but rarely occur in women under 20 years old. Now you can see two now you can see the left ovary, and this left ovary is echo-mechonormal. The prevalence of endometrial polyps increases with age and range from 7.8 to 34.9%. Endometrial polyps are frequently seen in patients receiving tamoxifen. Other risk factors include foreign bodies, multiparity, chronic cervicitis, and estrogen secretions. Now you can see both the hemorrhagic ovarian cysts lying side by side in the right ovary. You have already seen the left ovary is echo-mechonormal. Now this is the right ovarian hemorrhagic ovarian cysts, two cysts, and you can see a large amount of thick sludge is seen. Multiple internal echoes are seen in both of these cysts, and both are the hemorrhagic ovarian cysts. And these internal echoes are possibly due to the bleeding in the cysts. Around 5% of uterine polyps are cancerous or precancerous. Most polyps are asymptomatic, although they can be common cause of postmenopausal bleeding, and this can account approximately 30% in about 30% of the cases. In premenopausal women, they can cause intermenstrual bleeding, metorrhagia, and infertility. In premenstrual, uterine polyps range in size from a few millimeters, not longer than sesame seed, to several centimeters, that is golf ball size or larger. They attach to the uterine wall by a large base or a thin stalk, you can have one or many uterine polyps. Now you can see both of the hemorrhagic ovarian cyst along with the uterine polyp and a small cervical cyst. The cervical cyst measures about 1 centimeter in diameter. The main difference between fibroids and polyps is the tissue they are made of, as fibroids are made of connective fibrous tissue, whereas polyps are made of same tissue that makes up the uterine lining, also known as endometrial tissue. Now, signs and symptoms of the uterine polyps include irregular menstrual bleeding, for example, having frequent unpredictable periods of variable length and heaviness. Then there is bleeding between menstrual periods, excessive heavy menstrual periods, vaginal bleeding after menopause, and infertility. Now, causes of uterine polyps: each month estrogen levels in women rise and fall, causing the lining of the uterus to thicken and then shed during period. Polyps form when too much of that lining grows. That may be due to changes in the estrogen levels that happen just before and during menopause. Now you can see this is the polyp, and this polyp measures about 2.4 centimeter into 1.3 centimeter, while both the hemorrhagic cyst measure about 3.9 centimeter into 3.8 centimeter, and the other is 3.2 centimeter into 2.8 centimeter. Thanks for watching. Please subscribe my channel. If you do like this video, please